Hi, everybody. It's Dr. Mary Gardner. This is my third try, so third time is the charm, and hopefully this will go over well. I apologize for technical difficulties. I just moved back from Southern California Southern California back to South Florida this week, so it's a little bit hectic, and maybe my Wi-Fi is not so great, and so I do apologize, so we're still living out of boxes and being crazy. So one of the things I've had to do is also move here with my older pet. She's meandering around somewhere, and she's a 12-year-old dog that has some mobility issues herself right now, and that's what I wanted to focus on this Facebook Live. So I apologize if you were with me for the first 10 minutes of my last one that got disconnected, but hopefully I moved closer to the Wi-Fi signal, so hopefully this will be good. We're just a little bit closer to some sound that I don't know how to turn off yet, and that's what happens when you move into a new house. There's a lot of switches and things that I don't know how to change. So, but let's get to talking about one of my favorite topics, which is mobility issues, because when I started doing end-of-life care and seeing geriatric pets, I kind of thought I would be seeing a lot of cats because we go into the home so much, but, and cats don't like to go anywhere, but I actually see so many larger dogs that have mobility issues, and not just the big guys like the Great Danes, but also just the 20-pound dogs that have some reasons to have mobility issues. So that's probably our number one symptom that owners call us out for, is because their dog or cat has mobility issues. So I'm going to talk a little bit about kitty cats. I can't ignore them, although the title of this is for mobilities for issues in dogs. So I want to go over first some of the causes of mobility issues. I'm not speaking about the accident, so a torn ligament or a broken bone. Of course, those are acute and either need to be fixed with surgery or some other medical means, but really the long-term diseases that we see in pets, particularly joint diseases like arthritis. So our dogs and cats can get arthritis like we do, and so that can affect any joint in their body. Usually we see it in shoulders or knees or hips. Hips are the number one place that we see a lot of the joint diseases, but also in the back. We can see arthritis in the back joints, but also just regular back issues like throwing out a disc, like we say as in our human world. And so dogs can also hurt their discs, which can then lead to mobility issues. Another reason for mobility problems is cancer, particularly osteosarcoma, which is cancer of the bones that usually affects the long bones. So we'll see it more in legs, so the front or the back legs, but sometimes we'll see it in back bones or even in ribs. So that's one cause for pain that could decrease mobility. Also, the other types of cancers, the benign cancers, so just a very large fatty tumor. A lot of times we don't do anything with little fat bumps around your dog, but sometimes they can get so big that they actually get in the way of proper mobility. So I remember one time when I was in general practice, I removed a 15-pound fat ball, if you will, a fat mass from a dog, and it was just preventing him from walking well, and it kept rubbing up and getting ulcerated and actually even bloody. So the tumor was not cancerous or not malignant, but it was just affecting his mobility. So sometimes those fat balls we have to get rid of. Another cause for mobility issues is neurological. So there's a couple of different neurological diseases. One that we see most common is called degenerative myelopathy. So we see it in larger breed dogs, particularly our German Shepherds, and that's something that's progressive and long-term, unfortunately, fatal. And so we'll start seeing some early signs, maybe around 9 or 10. And so the neurological disorders really kind of start very subtly. So it might be a little toe drag. So you might hear as you're going for a walk in the street, you might hear your dog drag his toe. Or maybe when they stand up, you see them almost standing on their backs of their paws, if you will. And so those are signals or signs that basically the signals that come from the feet to the brain and vice versa, back and forth, are something's not connecting. So that message trail is not working well. So those are the neurological problems. Another reason why dogs and cats too might have mobility issues is because of weight issues. And I hate to bring this up, but a lot of our pets are overweight, and especially as they get older and they're not exercising as much, and we love to give them a lot of food for love. And I'm guilty of it as well. So unfortunately, when you add weight issues on top of some of the other diseases, it could be just compounding. And then last disease that I want to talk about is actually something that a lot of people don't realize, and that's just old age muscle loss, so muscle atrophy. And the medical fancy smancy word is sarcopenia, and that just means basically old age muscle atrophy. And sadly, we get it too. So as we get older, just our muscles start to atrophy, and that over time can lead to some really bad mobility issues, and medicine doesn't necessarily help because there's not much that we can do for that. So I want to go over, so those are some of the causes for mobility issues, and now I want to go over the signs. So that way, how do you know if your dog or cat has mobility issues? And dogs and cats do not talk about their pain like we do, right? So if there's something wrong with me, I'm going to let everybody know that something hurts, and if I do a certain something that's painful. But our dogs and cats don't really benefit from complaining. They don't complain too much, especially a Labrador. They never have a bad day. They can have a broken leg and they'll still wag their tail when they see you come in the door. But it's hard to assess pain in dogs and cats. So we have to kind of look for the subtle signs because they don't always tell us. And sometimes they do, but sometimes they don't. Number one sign that I see is of course struggling to get around the house. So a lot of our floors are tile or wood, and so they're like an ice rink to the pets. So they kind of walk tentatively or just walk down a certain alleyway, if you will, and don't navigate the easy or the more difficult paths. They just kind of go for the straight path. And also when they're standing in front of their food bowl or their water bowl, if you notice, their legs start to splay, so they start to do a split slowly, and then they get back together and they slowly. So oh, I hear somebody's also guilty. Okay. So I will always throw myself under the bus. I'm a vet, but sometimes I don't always take my advice, and it's hard when they're giving you the eyes, right? But that's okay as long as we do our best. So back to the standing in front of the food bowl. So you'll see them start doing that slow split, if you will, and then they'll get themselves back together. So that is that really has a lot to do with the ways that the muscles atrophy. So remember earlier I was talking about the muscle atrophy, that sarcopenia. So our muscles are made up of different muscle fibers, and so some fibers help with standing and keeping our legs in that standing position. Those same fibers are also responsible for getting up and laying down. So we'll see that a lot where dogs have a hard time getting up. They'll struggle getting up. They'll use their front legs, and then the back legs will go up. And actually, dogs that are not so painful, they usually get up their back legs first and then their front legs. So you see a change in how they get up, or by gosh, they take a minute just to lay down. So they'll circle, and then they'll finally lay down, and you just want to lay down, but they're painful, and so and not just painful, but they're just weak, and so the muscles that are used to get up, get down, jump, or even stand with the legs in a position to stand. Those muscle fibers atrophy first and faster than the other ones that just are used for walking. So that's what I'll hear a lot is like, he has a hard time getting up. Once he's up, he can keep walking for a few miles. And then when we get home, he can't lay down. So it's just the way that the muscles are. So just be watching for that up and down or standing in front of their food bowls. Also just favoring one side. So you might see them, of course, limping. So that's, obviously if one side of you hurts, you kind of see that limping. If both sides hurt, you won't be able to see the pain as well. But there's something called down on sound, and it's something that we just say in the vet world, because when you limp, you put more weight on the good leg, right? And so if your right leg hurts, then you're going to put more pressure on the left leg, so that way your right leg just takes a little bit of it. And so that is that head bob that we see dogs do. That means that if you see the up, that means the leg that their head is up on hurts less. It may hurt also the same. It may also hurt, but maybe not as bad. So I look for a change or a head bob, and that's what I call down on sound. So if you see that might be a sign or something to let your vet know. Now I did promise to throw in a little kitty cat discussion. So cats, as you know, use their litter boxes, and so if you start to see that your cat is inappropriately urinating, usually right outside their litter box, it's not because they're getting old and sassy. It may be because they can't get into the box. The sand is so deep, or it's difficult for them to actually cover or make their little hole. And an interesting side fact is that cats are actually right or handed, like we are predominantly, one or the other. And so let's say if a cat is right-handed and that shoulder has got arthritis, they may not cover their bathroom as much. So if you start to see that they're not covering where they've gone to the bathroom, it may not, again, because they're sassy, it might be arthritis in that one side. So these are some signs, just subtle signs. There's a sawhorse stance. So if they stand there like a sawhorse in the front or the back, that's a sign of pain or discomfort. I talked about earlier the dragging of the toes. So again, if you start to hear just a little drag of a toe as you're walking, or that they're not, or they stand but then they flip their foot over. Sometimes they don't even flip their foot back over. Other signs of mobility issues, of course, is pain, is increased panting. So you might see them panting a lot more, change in their facial expressions, maybe not wanting to be pet in certain locations. So a lot of times, I always warn owners who have children, if they're petting that pet that's got arthritis, be very careful, because maybe they're hitting a spot that's painful, or leaning against them that's painful. And so even though most of our pets, would never hurt a family member, that's the only way that they know to say, hey, that hurts, is to, growl a little bit or even snip at them. And a book that I highly recommend, and my helper will put a link to this book, is Dr. Michael Petty. He wrote a book for pet-owned dog owners called Pet Relief for Dogs. It's a fantastic book. That's a very easy read, but it will help you identify if your dog is in pain. So I absolutely recommend reading that. Even veterinarians should read it. It's awesome. And so now just a quick thing about cats again too. So there was a study done that asked cat owners what their quality of life means to them for their cat. And only 40% of the things listed had to do with mobility. So if you think about your dog and what's a good quality of life, you might say going for walks all the time, or running or jumping. Well, cats don't go for walks usually. There's a few out there. But so for cats, 60% of what owners identified as quality of life for their cats were just doing certain things, like lying in the sun, like looking out the window, looking at the birds. However, if they've got mobility issues that prevent them from getting in that sunbeam, or lying or looking up at that window, that may be a sign that they've got mobility issues, because they love to do those things and they can't do them anymore. So if you start seeing some signs on your pet, what should you that might have some mobility issues or pain, definitely go see your veterinarian. They doing a good physical exam is really key, because they're going to feel both knees, let's say, and they're going to see if one feels a little bit swollen. They're going to feel for pain. They're going to look for these subtle signs that you may not have seen. And sometimes getting a fresh pair of eyes is important. Now, when you go see your veterinarian, or your veterinarian comes to your home, have videos too to show what's going on in your home. Because when you bring your car in for the rattle, it never rattles to the mechanic, right? So same thing, when the pet goes into the clinic, they're all either excited or scared, right? So they're going to be in the scared position, or just so excited that you're like, I swear he's got these mobility issues and he's not showing them. So that's the benefit at Lap of Love, that we get to go to the home so we can see the environment a little bit differently. So, but just write down these things and bring a video, bring pictures to your vet. So the physical exam, now they may usually ask to do some x-rays, which is a great way for us to see arthritis or some other things. The more advanced techniques, of course, would be a CT or MRI, and that's usually if we need to look at discs in the back, or even some cancer. And if we do see a bump, we always want to do a little cytology of it, which means just taking a little wee sample of it, looking under a microscope to see if there's some bad cells in there, or if it's just benign. So definitely, if you see the signs of mobility issues for your dog, definitely bring him into the vet to understand what you're dealing with. So, because you want to know, am I dealing with a neurological problem, and what's the progression of this, or is it just muscle atrophy, and I could still do some exercise with them? or if it's a really bad hip joint, then you might want to limit some of the things that you do and put them on some pain relief. So there's a lot of different drugs that we can use that are safe. I know that sometimes as we get older, especially with other diseases, we want to be careful that we don't do more harm than good. And so long term, just like us, if we took Tylenol or aspirin long term, our kidneys are not going to be totally loving us, right? However, for the short term or just sometimes chronically at a low dose, we will benefit from medications. So anti-inflammatory medications that are safe for pets, please do not give your pet anything that your vet has not told you about, because some things, especially in kitty cats, is fatal. So there's anti-inflammatory medications, pain management, and also some nutraceuticals. And when started early enough, can be very beneficial, like fish oils. And so my dog is on fish oils basically from a young adolescent age. So even I should be on fish oils, which I'm not on the supplements I should be on, but I think my dog gets a lot better care than I do. And then there's also some injectable medications like Adequan. So my dog was on Adequan for a while, and that's just a little sub-Q injection given 1 to 2 times a week long term. So that's something that you should ask your vet about and can be so helpful. Again, because dogs and cats do not complain about their pain does not mean that they're not in pain. And it doesn't mean that once we fix some of that pain that they can start to live a much better quality of life. Some other things that we can do in the your veterinarian might be certified in acupuncture, which is hugely beneficial, or know somebody in the area that could do acupuncture. My Doberman, before he became an angel, he got acupuncture once a week, and he loved it, and he was great at it. There's some massage techniques that you could do, and so some acupressure that sometimes your veterinarian could teach you some things to make your pet feel better, or even some rehab facilities can do water tread training, the pool therapy, things like that. So there is so much that's out there that's available for our pets. I'm actually going through the certification for my rehabilitation certification, which is a very long process and a lot of studying to do, but it's something that I just love and things that I can help my older pets with. Now, some other management tips, and we're going to post some links for some of these items for you to look at. So one of them is a harness. Now, I love harnesses. I know a lot of pet owners, when they see their pets trying to get up, and that getting up is so hard, right? They'll run over and they'll try to help them up. And that's where sometimes they could get into trouble because they might hurt them a little bit more, or just, pinch something, or they'll run for a beach towel, right? And try to put it underneath them in time. Well, by that time, the pet's gotten up, right? So I love harnesses that we can keep on during the day and use really quickly. And so my favorite one is Help 'em Up harness. I love this harness. I use this for my 110-pound Doberman. If Sam, knockwood, ever needs a harness, she's running around here somewhere, this is the one that I will use. And I love it because it's a 2-piece. It's got a front and a back halter harness. And so we just posted that link. So even if it's front-end mobility issues or back-end, it's going to cover both. And what's nice is it really distributes the weight well. So you're not just, some of the harnesses I think are a little bit aggressive, like just almost like a girdle in one spot on the abdomen of the dog. So I really like how they've set this harness up, and it's got really nice sturdy handles, so that way you can pick up even a 200-pound dog. But the most convenient thing about this harness, the Help 'em Up harness, is that they're gender specific. So for little boys or girls, they have a different anatomy. So you'll select your gender. That way you can keep them on. So that way they can urinate appropriately and not take off their harness. But I always like to take off their harness once a day. Make sure that there's no abrasions or anything like that. Just make sure their armpits are airing out and whatnot. Now, another thing that I used for my Samoyed, who's been an angel for 3 years, was booties. So there's a couple of different booties on the market, and we're going to show a picture and also a link to the ones that she used. I used rough wear booties, and so now listen, when she first put them on, she kicked like a donkey, but afterwards she got used to them. The only thing I caution you about wearing booties, which I do like, and there's many different kinds, is make sure that you take them off a few times a day, air out the toes, make sure that there's not dirt or abrasions going on, because I've taken off some booties that were not taken off in a few days, and it's not so good inside. So I love booties, but you have to be patient, because sometimes that's like me putting on a set of heels. Like I'm gonna not be happy for a little while, but then you get used to it. Another product that I love, and it was invented by another veterinarian, Dr. Busby, is the toe grips. So what these are little rubber bands, is best way I can explain this. And they're put over the nail. And so what it does is it adds a little point of contact and traction. So that way when a pet is walking on tile, or really anywhere like tile, I got a question there about TENS unit. Don't let me forget. The rubber will hit the road, and so it actually gives them a little bit of traction. So these are toe grips, which we're going to place the link on there. If your dog has nails that don't hit the ground, it won't be good for it. But a lot of times our toenails are hitting the ground, and our toenails are hitting the ground sometimes too much, and we need a little pedicure. So bring them to the vet to get a pedicure, and we could place these toe grips on there as well. So I've got a question from Missy about TENS unit for dogs with muscle atrophy. And I have had knee surgery myself and used the TENS unit. And so, yes. And when my Samoyed had a hip surgery, we did do a TENS unit during her physical therapy. It definitely should be medically supervised, because we want to put them in the appropriate position for the appropriate pulsation and length of time. The struggle with dogs and the TENS unit, and cats too, but is they've got fur. So we've got to shave some spots where those little sticky things go onto, which is fine. Like, I would much rather have my pet feel better than a couple of bald spots. But absolutely. But again, it really should be supervised by somebody who's trained in that, because it could go wrong. So I just caution you. But absolutely, and I did it for my own. And I never recommend anything I wouldn't do for my own, just so you know. Beds. So a lot of times people will look for orthopedic beds, which are great. But sometimes then your dog doesn't like them. So you might go through some trial and error. I also don't recommend too thick or squishy of beds. So be on the lookout for something that's a little bit lower to the ground. And you're welcome, Missy. And a bed that I recently came across, and we're going to put the link to this, is a bed that's got a mesh bottom, and it's elevated off the floor, because a lot of times our older pets, especially with mobility issues, might soil their beds or pee in their bed. And so it's very difficult to clean some of these orthopedic beds. But this one bed, which again, we're going to post the link to it, has this mesh, so that way if they do urinate, it will fall through a little bit easier, so it's easier to clean. It also allows a lot of circulation. So I love to get some circulation, and I have a picture of Sam, who used her bed, which hopefully we'll post a picture of later on. So the 7 Gen Pets link is going to be posted for that bed. So another type of bed, and you wouldn't think about this, but again, because our pets sometimes have urinary problems, and especially at night, they may pee in their beds. Anything waterproof. So baby mattresses can be hugely successful, and they're of a perfect size for some of these dogs. So just go to even your Salvation Army or thrift store might have a used baby mattress, and usually things that are baby are waterproof. So that's very helpful. So just back to our little kitty cats. I was talking about, thank you, Diane, you're so sweet. I was talking about kitty boxes, the litter boxes. And so making sure that the litter box entrance is lower, that they've got stairs or easy access to their litter box, because if they start to have some cats with some arthritis, it can be really painful for them. And last live video I did, some person said, some wonderful client said that they use the underbed Rubbermaid storage units, like those things that slide under your bed to store like wrapping paper and stuff like that, as her litter box, because it was lower and it was really big. So that was an awesome suggestion. So again, feel free to put your suggestions in the comments. Now, I think the number one thing I recommend to my pet owners when I go into a home to help with mobility is yoga mats. Not to do yoga, but to put them all over the house. So yoga mats or bath mats. And so I want the good bath mats that have a really sticky bottom and a fuzzy top, or something that's just comfortable for the pet. Or yoga mats are so easy because you can just cut them too. They can go up and down stairs. So I can't tell you how many homes I go into that have just these ice rinks of tile and hardwood. And of course, since I'm in Southern California and South Florida where I've lived, everything is tile. And so they're just skating around. Cover your floors. Minimally, you need some runways to the doors, to their food bowls, to their beds, to their favorite spots, to next to your bed. Have runways all over the place. But I've seen some people that cover their place in bath mats or yoga mats, and kudos, because that's what their pet needs. Now, what's great about the bath mats or the yoga mats is that, because if they've got the muscle atrophy like I talked about earlier, if they're scared to walk on the floor and they're not walking, and so that way they're not using their muscles, and when muscles are not used, they're going to atrophy more. And so we want to make sure that we're always encouraging our pets to actually move. The Arthritis Foundation for Humans, their slogan is keep on moving. So we always want to make sure that the pets are safe, feel safe, and supported. And so these yoga mats and bath mats around the house are so vital, and it keeps them moving, it keeps them walking. So also put a bath mat or yoga mat right in front of their food bowl. So that way, if you see them doing that slide, that split, put it right in front of their bath mat. So some other items, there's some new stuff out there. I love going to conferences because I get to see some new items out there. So I already talked about the toe grips. There's also something called paw friction. So what this is you kind of put a little bit of glue on their pad, and you dip the pad into this blue sand, if you will. So it creates a grit, if you will, on their pads. And so, and it lasts, I can't remember, either a week or two or something like that. So you just kind of reapply, and that's been really helpful for some pets. I even went to one home that had everything set up great in their house, but their back deck had 2 stairs that the pet always slipped on. And so they got a little quart of paint and put sand in it, and then painted those steps, so it added some grit to the step. So Kevin asked, is it common for a dog to lead with a weak paw? So not necessarily, Kevin. And dogs are tough. They're going to put more pressure on the good paw. So sometimes leading, is the one that they're going to put more pressure on. And it also depends on where they're navigating. So if they know if they have to go downhill, they're going to, if you've got a slope, a pet will want the weight more on the good side. So if you imagine skiing, right, and you've got one good leg or bad leg, you like the side that you're leaning on, so you're going to put more weight on it. So it's whatever action they're doing, if they're putting more weight on it, that's usually going to be their stronger paw or the one with less pain. So I don't want to just say black or white issue, but it's something that we're going to look together as a whole picture. Something to also consider is just protecting your pet from unsafe areas. These pets get stuck some places, and then of course if the floor is slippery, then they're going to get stuck, and you add on other problems that they're having, like cognition issues, and then they get scared. So baby gates, or last time I suggested also tension rods. So tension rods like shower curtain rods, but even mini versions, so like curtain rods, and just putting them around the house where we want to kind of block off our pet. So unsafe spots. Another pet owner, and I get the best ideas from pet owners, those sticky things that you put on the bottom of your bathtub so you don't slip? So there were suction cup ones, not stickers, but she found like these suction cup ones, and she was putting the path around her house with these things at the bottom of the bathtub. It was great. So also some mild things that you could do, like elevating their food bowl, because if it's leaning down, it's tough on them. Making sure they have thermal environments that are conducive to how they feel. So a lot of times owners will say, do they like hot or do they like cold? What should I do? They're going to tell you. So you'll see them sleeping on the tile floor more, or cats, it's like me, when I have hurt something, I like heat on it, so they might sleep in a sunny spot more. So you need to just give both. And last thing I want to talk about is grooming. So a lot of times, especially kitty cats groom themselves, and when they can't groom because of pain or arthritis or mobility issues, they're going to start to get mats. And so making sure that you groom them, and that will release endorphins too, in both the cat and you. And this goes for our dogs too. Dogs don't groom themselves, but loving on them, massaging them, grooming them, all releases endorphins, which makes them feel good, and then they want to do more. So with mobility issues, you want to find out what the cause is, so that way we can do the best assessment and best ways to treat it. So it may be some pain management, it may be some anti-inflammatories, it may be nutraceuticals. There's some great diets out there too that have support. But we want to find out what we're dealing with if we can. Sometimes we can't, but we want to manage the symptoms really well. So environmental changes, like I've talked about, are so easy. They're not expensive. Yoga mats, are pretty cheap. So, don't get the big squishy ones, get the cheap ones. And what's also great is that they're easy to wash. So if they do soil them, it's easy to wash. Your house is not going to look beautiful. So, but that's okay, right? So they give us such love and affection that I will have an unmatched house all day long. So again, hopefully this is giving you tips. They're not going to be telling you that I'm painful, but definitely look for the subtle signs. And you guys know your pets best. So I've got a tricky question out there. What about CBD oil? So not all states, are we allowed to talk about this as veterinarians because it's not legal in all states. So I will tell you though, a lot of people have benefited from, a lot of people with their pets have benefited from CBD oil. So I myself would give it to my pet. So hopefully that answers the question. At this point, I'll try anything. I'll try anything to make them feel better. So even sometimes, especially towards the end of life, if I know that my pet, I've got just a few months left, I'm still going to give them the medications that I know may be hurting their liver long term, because my primary problem right now is the pain and mobility issues. So we see so much of that. And it's hard though, it's so hard to manage. And I know we talk about the big Great Danes or the big Golden Retrievers, but even the wee little dogs, those are harder for me. I'm very tall, so for me to lean down and help up a smaller dog is actually harder. So we have a lot of different resources available for you. I've collected some resources on an Amazon page just for you guys to go kind of peruse or just give inspiration to look into. And on our website, we've got a lot of information. And if you think your dog or cat has mobility issues or any type of pain, absolutely, please go see your veterinarian, talk to them, bring in videos and pictures, write down their daily routine and the ways that they've changed. And so that way they can help you out. And Kevin, I'll answer that question in a comment. And so that way you kind of know. But don't hesitate to reach out to some of the experts and get their advice. And, us at Lap of Love, we come to the homes, which is so nice because we can see the environment. So hopefully that was helpful. Mobility is such a huge issue. I've dealt with it myself in almost all of my dogs. So I get it. And right now Sam is okay, but she's a 12-year-old big dog. So I know that's probably in my future. Oh yes, Tracy, pet ramps, pet stairs. God, there's so many things. So on some of our educational website information, we've got some links to some great products. So hopefully this is helpful. And everybody, please write your own ideas. So that's how we learn from each other. So put your own tip in the comments, so that way we can benefit from each other's ideas. So have a good rest of your day. Sorry about the technical issues in the beginning, but it ended up well, I hope. So speak to you guys later. Bye.